Good afternoon, everybody, and thank you so much for joining our GOT15 webinar series presented by Novatech Medical Data Systems. We are so excited to showcase our new disease control and hygiene monitoring software. Today, you will be seeing part one of a four-part mini 15-minute webinar series. My name is Nisa Barkat. I am the Associate Director of Marketing at Novatech International for almost 10 years. And on the line, I have my colleague, Shiva Zaman. Hi, Shiva. How are you doing today?
Hi, Nisa. I'm great. Thank you so much. So I am our Head of Product Specialists and Training Services at Novatech. I've been here for a little over 19 years, and I'm also really looking forward to showing you our new solution today.
Thank you so much, Shiva. Before we start, we'll just go over a few housekeeping rules. All webinars for the series are 15 minutes or less, and we encourage you all to submit your questions and comments in the question panel, and we'll be sure to email them to you individually after the webinar is over. By default, your microphones are all set to mute, and last but not least, a recording of all our webinars will be sent to the registrants of the webinar series. So without further ado, let us get started. We are so excited to introduce to you Novatech Medical Data Systems' new disease control and hygiene monitoring software in response to the novel coronavirus. Our focus and our goal is to save patients' lives and protect healthcare frontline workers through better data collection, analysis, and reporting. A quick history about Novatech. We've been in the industry for over 20 years with a focus on life science and healthcare expertise. Our main focuses are on contamination control and mental health. But today, we are actually going to look at the situation that is upon us, the recent COVID-19 pandemic. We all need to understand that outbreaks are not a one-time event, and the fragility of our healthcare system during this pandemic made us realize the importance of prevention. Recent pathogens have brought with them the necessity to monitor with vigilance our hospitals and healthcare facilities such as elderly care homes. At Novatech, it is our mandate to help these facilities reduce risk. This is what we know how to do best. And we want to reduce risk to have better control of outbreaks. The cost of prevention will always be far less than the cost of reaction. So without further ado, Shiva will now guide you through how Novatech's disease control and hygiene monitoring system, DCH, what we refer it to, will actually do this. Thanks very much, Shiva.
Thank you so much, Nisa. So in response to the concerns that Nisa mentioned with regards to outbreaks, and it is a reoccurring event, Novatech has released a disease control and hygiene monitoring software we call DCH for short. So DCH is a solution that's developed to assist governments as well as public and private hospitals and caregiving facilities to detect and contain infectious disease or any potential viruses before they have a chance to spread and become a threat. So what we have is a hardware software solution that has features such as the ability to monitor locations, personnel for contamination, for viral contamination, for example, quickly screen through thermal cameras incoming visitors into the hospital, determine the effectiveness of cleaning procedures, cleaning agents, hygiene practices, and all the while it has statistics and trending that's built in that allows you to receive early detection and warnings for any potential contamination, whether that's within equipment, within personnel, within rooms, and it's all done in real time, paperlessly, and it also tracks inventory amounts. So as Nisa mentioned, early detection and warning is key. So we do that through thermal screening with cameras at entrances, for example, of hospitals. This data collection and monitoring allows hospital administrators to make early decisions with targeted data collection. So you can do a minimal amount basically of sampling, but in the high-risk areas, in order to really target the areas that you may have to work on to prevent contamination. So that early detection and early identification is really key. So the early identification can be done through the trending and statistics of the software in order to see where the potential source of contamination is or potential contamination and prevent occurrence or reoccurrence. That information and that knowledge is key to rapid response and timely decision making in order to prevent and contain outbreaks. And with data historically over time, it helps predictive analysis as well. So you'd see that as throughout the use of the system. So DCH, our disease control and hygiene monitoring software, helps control outbreaks in 4 ways. So the first of which is monitoring entrances, which we'll talk about today. On July 23rd, we'll talk about monitoring people, so monitoring personnel, monitoring the cleaning effectiveness of any PPE that would be reused. On August 6th, we're going to look at monitoring rooms and locations within those rooms, routine sampling that is targeted towards high-risk areas that would help prevent proliferation within those common areas, and how trending those areas can help you determine, first of all, the high-risk areas, as well as assess root cause when necessary. On August 13th, we're going to look at monitoring critical equipment. We'll look at environmental conditions as well within that and see how those factors plays a role and can affect outbreaks, and how DCH can basically mitigate that risk. So today, as mentioned, we're going to look at monitoring entrances. So as you may have seen during the COVID-19 outbreak, some hospitals had put a secondary or external entrance and changed their entrance protocols to prevent cross-contamination from the COVID versus non-COVID patient population. So, you know, getting that information ahead of time to put in those types of protocols is key. And so we'll be looking at that through thermal screening of infected visitors, or looking at their temperatures, as well as detecting spikes in traffic counts. When we look at monitoring people on July 23rd, that'll really be for risk-based sampling of personnel, of your staff, and how to do that risk and ensure gowning procedures are complied with, and cleaning effectiveness of the PPE is also key there. And on August 6th, we're going to look at monitoring rooms. So how routine sampling through swabs, dip slides, contact plates, sponges, or any existing monitoring that's being performed can be streamlined to be made extremely effective, to be targeted specifically towards high-risk areas, and as such prevent proliferation within any of the common areas, or where potential cross-contamination between patients and staff may occur. On August 13th, we'll look at critical systems such as HVACs and how proliferation could occur within equipment, how environmental conditions could affect the outbreak, as well as utilities, and how the DCH software may mitigate those risks. So overall, what the benefits of DCH are is that they maximize the amount of resources that hospitals can assign to contamination control, basically to preventing outbreaks. So we do so using automated equipment, so like the thermal cameras. So the thermal cameras are the hardware part of our software solution. So by automating that, we need little to no, human intervention, and by trending and doing analysis, we're able to detect and eradicate contamination early, enough to, determine potential root cause and take rapid response and make good decisions based on good data. So making those informed, timely decisions is really the goal of the DCH software. So let's get into our first scenario, which is monitoring entrances. So here is, as mentioned, there's 2 parts to it. So the thermal cameras are looking at 2 things. One, the temperature of visitors, patients, and personnel. And secondly, it's looking for changes in traffic counts. So basically, we're looking at setting alerts for higher than normal amount of people walking in with a fever, or a higher normal amount of people in general that are walking in. So one example is that on day 1 here, we have a random map of a facility with 3 entrances, a north tower, a south tower, a taper, and each one of them have one entrance that you can see there. They're marked with green dots, meaning that the amount of people walking in with a fever is still below the user set threshold. So you may set, and you may look at historical data within the system to properly set thresholds at which you would like to be alerted in order to potentially investigate why there is a higher than normal amount of people walking in with a fever. So we see on day 2 that the entrance to the north tower has hit an alert level, meaning a higher than normal amount of people are walking in with a fever. And as I go to day 3, it's worsened. So my north tower is now red, meaning action is required. And so potentially that might be changing the entrance protocols. It may be changing the entrance protocols to all the buildings. It may be just to the north tower where we're seeing that. We have more data on day 4 as we see that the north tower and the south tower are now under action required. The taper has an alert. And then finally, this has spread in day 5 to all 3 entrances. So the idea here is to give quick, early alerts in order to make those decisions when it's key. You know, doing that a day, 2 days, 3 days, 5 days ahead of time can really affect the amount of lives that is saved and the amount of cross-contamination that occurs. This is our second parameter that is acquired from our thermal cameras, and that's basically the traffic count. So I have the same 3 entrances as in the example earlier. So I have the north tower, the south tower, and taper. And I have this data in a bar chart. I picked a daily bar chart, so the time range is up to you. And you can see that on March 31st, you see the spike has gone past that first threshold. And again, that alert level, action level, and we put a third level, a control level, is all assigned by the user and can be assigned based on historical data and can be adjusted as needed. So when you do get that alert level, you get an email notification or a text message, however you wish to be alerted, so that you can go and trend and investigate and potentially take action in order to prevent an outbreak. That same data is also available in a linear regression or various other chart formats. It's available in a scatter plot. We have control charts that'll show first and second and third standard deviations so that you may set your alerts according to those deviations. And what I like about this monitoring of entrances is basically, as mentioned earlier, it's completely automated. As soon as it's set up, it requires little or no human intervention. It's simply that a person will be notified once an alert level is reached. And at that point, they can go and trend the number of people, trend it against historic data, and look at, has there been any serious incidents, accidents, epidemics, pandemics? Do I need to assign more staff? Do I need to change entrance protocols? Do I need to retrain staff on anything? So having that specific data that's centralized in one place, alerting you in real time against both traffic counts and people walking in with a fever, can be done with just minimal amount of resources. And that early warning and data collection is really key and can help timely decision making to reassess those entrance protocols, so that be done really at the time that it should be done in order to save lives. Prevention and rapid response is really what can help save lives, and therefore saving lives through better data. And with that said, I'll pass it on to Nisa to talk about our future webinars.
Shiva, thank you so much for sharing part 1 of our 4-part series about DCH. I hope the viewers today were able to see the value of the monitoring of the entrances. A reminder to log in back on July 23rd, August 6th, and August 13th, where we walk you through a very similar story for monitoring people, monitoring rooms, and monitoring equipment. These 4 stories have been put together by Novatech to pretty much put in a holistic solution for prevention at these very fragile healthcare facilities. Thank you so much again, and we will like to hear from you, and we encourage you to contact us first via email or connect us with LinkedIn. And if you would like your own personal demonstration of us walking you through all 4 scenarios, please do contact us for a live demo. And if you can, do share these webinars with anyone in the industry or any of your contacts that you feel would benefit. So once again, thanks again for joining us for our GOT15 webinar series. Please take note of our next webinar, which will be Thursday, July 23rd, and we look forward to seeing you then. Thanks again, Shiva, and thank you to everyone joining us today.
Thank you, Nisa. Thank you all for joining.